The FDA is proposing new steps to reduce the amount of lead in baby food. The plan would add new limits to processed foods to limit exposure to children who are younger than 2. But Consumer Reports says it's not enough. Joining me now is Ron-Holm, who's Consumer Reports Director of Food Policy. Good morning. Thanks for joining us.
Good morning. Thanks for having me.
I'd like to back up for the benefit of our viewer who might have missed initially the Consumer Reports investigation, which discovered lead in store-bought foods. Would you explain what Consumer Reports discovered and how much lead was found?
Absolutely. So what we did was we analyzed 50 nationally distributed packaged foods that's made particularly for babies and toddlers. And what we did was check for lead and other heavy metals that are considered to be the most harmful to human health. And what we found was about 2/3 of the products contained concerning levels of lead, cadmium, and/or inorganic arsenic. And 15 of those products actually posed a risk to a child who ate just one serving or less per day.
Was it any particular type of food? I mean, what's the source of this lead?
Yeah, it was primarily infant rice cereal that caused a lot of problems in our test. And, we've encouraged manufacturers to limit production or eliminate production of the products that contain high levels of these heavy metals. And some have responded and removed some of those products off the market. So that's certainly encouraging news for families and parents. But there are some products out there that still have high levels, as our studies have shown.
And so the FDA, this is basically, it's drafting its guidelines right now. So a final has not been, released at this point. What is it proposing? And then I'd like to talk a little bit about why it doesn't go far enough.
So what the FDA has done is propose limits for lead in some baby foods, but not all baby foods. So now some of the limits they are proposing are stricter than European limits. So that's certainly encouraging. And we would encourage more of that type of work. But what the FDA needs to do more of is to limit exposure to toxic lead and other heavy metals to protect babies and young children in other baby food products. And so we'll be urging the FDA to really work to strengthen these limits even more as they work to finalize the standards.
So you were quoted as saying it appears that the proposed standards were set based more on current industry feasibility to achieve the limits and not solely on levels that would best protect public health. Why?
That's right. I mean, I think that's, for a public health agency, the FDA should be focused solely on what's the best approach to protect babies, not what they feel like the industry can achieve. And I think the concern is, they're not encouraging industry to work hard enough to reduce these lead levels and heavy metal levels in baby food, given how vulnerable young children are to toxic exposure. And our data has shown that it is possible to reach lower limits, and there are products that have done that. So it's certainly feasible to set these limits lower.
And Consumer Reports seems to focus specifically on these kind of, as you've characterized it, so-called kind of baby junk foods, the rice puffs. So for our parent at home who's watching, who has an infant or a child under the age of 2, they're sitting here listening, okay, which one should I not feed to my baby? How do you respond to them to give them the best information so that when they're at the grocery store and they're trying to make decisions, they avoid the things that are not good for their baby or couldn't be?
Yeah, so the industry guidance that the FDA issued, what it failed to do also was to propose strict limits on these so-called baby junk food, the grain-based snacks, the puffs, the teething biscuits. These foods typically contain high levels of lead, so it's very important to target these products as well. But the good news for parents is, they shouldn't panic. Consuming these foods doesn't guarantee that a child would develop health problems. It just simply increases the risk. So while it's not going to be possible to completely eliminate heavy metals from the food, but there are a number of things that parents can do to limit their exposure. That includes intuitive things that parents already recognize, and that's feeding them a wide variety of healthy foods, limiting the intake of fruit juice, limiting the intake of packaged snacks. Look out for foods that are low in heavy metals, and that includes such things as apples, unsweetened applesauce, avocados, bananas, peaches, yogurts. So if you diversify the children's diet, you have a very significant chance of lowering that risk.
And the fruits that you just listed, those would be in store-bought baby, in
That's
the
right.
containers. Okay, I want to make sure that.
That's right.
Brian Ron-Holm is Consumer Reports Director of Food Policy. Thank you for your time this morning. We appreciate it.
My pleasure.